Diamond. I'm the lead for the Center of Excellence for Health. We are extremely excited to be here. We have some beautiful experts that are going to be sharing their passion and their knowledge about nursing from NBCC, and we are celebrating Nurses Week this week and next week to really let the nurses know that we are thankful for the work that they do in our communities, in our schools, in the hospitals, and probably anywhere you go, you're going to see a nurse. So I'm not going to take much time, but again, really excited to have the teachers here. And if you're watching this, students, hopefully the information is going to be informative, but also give you an idea about what it looks like to become a nurse and what types of things do you need to do. So without further ado, I'm handing it over to my beautiful NBC experts, Stephanie and Crystal. Before I do that, I'm not going to forget, we have Tammy here, who is the chair of the Health and Wellness in St. Andrews, and I will hand it over to Stephanie and Crystal.
Hey. I'm Stephanie Ruxtall. I have been an RN since 1992. I was going to say 29. I got my numbers mixed up. Since 1992, and I've been teaching in the practical nurse program here since 2006. I've loved the teaching, and I love seeing how students take their nursing to all kinds of different ways from this diploma.
And I'm Crystal Petrie. I'm an LPN. I've been teaching here since 2022. Prior to that, I worked pediatrics is my passion. So I work with all kinds of lovely kids and helping them to feel better. I enjoy teaching because I get to share that passion and help those students be the best they can be. And the most rewarding part is then when I go back into the hospital setting and see them upgrade from their green scrubs to their blue scrubs or the red scrubs or whatever color they're wearing. Just knowing that you have that little piece of that is really cool.
Yeah.
So I think it's important to mention that you're also an alumni from NBCC.
I am a double alumni from NBCC.
Yeah.
Yes. Yeah. So actually, she was one of my instructors.
That's how long I've been teaching this, and I love it. And seeing them come back and show the students the things that they've sustained or kept of the learning that was taught to them when they were students. So it's been lots of fun being here, and it's been lots of fun being with the others in the field
for sure
and learning.
So we're going to kind of talk about what requirements you need, the different areas you're able to go into, because you can start slow and then work your way up if you want to gain experience before going back to school, or you can just dive right in and head start right to where you want to be. There's so many different ways to become the different levels of nursing, and there's different pathways and things like that. So we're going to talk about both how to become it through NBCC as well as through UNB nursing as well.
And it doesn't mean you have to become a nurse after doing the LPN program. We've had, or the PN program, licensing comes after, but we've had students take the PN program and then have gone in and become x-ray techs or have become cardio assessors. It all depends on what you find in the passion from the program you take.
So the requirements do differ based on what level you want to reach. So we did include the personal support workers, even though they can't refer to themselves as a nurse. They do set that foundation for nursing, and they are a huge, huge component of that nursing team and that whole big picture of caring for those individuals. So we wanted to include those. There is a licensed practical nurse. When you're looking for that in the internet world, I'm trying to say here, if you're going to look it up as practical nurse, because you eventually will become licensed, but we wanted to include that there, and then the registered nursing ones as well.
And the registered nursing program generally is required as a bachelor's degree in nursing. So that would become a bachelor in nursing. So that's how that would be looked up. But going back to the personal support worker, our system in Canada, if you're anywhere familiar with what's going on in the world, is so short in personal support workers because of our generation of people that are aging. So personal support worker is definitely a great career, a great field to go into, even as it is on its own, and it's always a great place to start to figure out if this is really the field you want for yourself. Personal support workers, although like she said, Crystal said, they can't describe themselves as nurses. They are the baseline of nursing for anything we do. They provide the basic hands-on care. They'll learn how to access them with the working safely, preserving their dignity, helping them with personal care, helping them maybe with meal prep, helping with their mental health, working in the community, working in hospital, working in long-term care facilities, working in other and anywhere else, even in the school setting, you'll see some personal support workers working there to support kids that have higher needs or disabilities. And like I said, an aging population that we have, it's very in high demand for personal support workers. We're actually seeing people from all around the world coming to Canada to take the personal support worker to be able to give this kind of care. It's that in demand.
And a lot of times with the personal support worker too, they're the ones who get to spend that even more quality time with those individuals and those families. So if that's your passion, is really providing that top-notch care to those families and patients, personal support worker is definitely the way to go.
We're not going to show the video.
No, probably not.
Okay. So the admission requirements at our college for PSW, it's a full 1-year program. It depends on what campus you go to, but here at St. Andrews, you would start in September and it would go straight through to June. Some of them have it starting in January, and they would go right through almost to the following December, because they still will get that 2 months in the summer. That's that summertime off, that their program is still a full year.
They go right through the summer.
Yeah.
They usually
They do?
finish. Yeah, they go
Okay.
right through the summer, and they usually finish up around October.
Oh, sorry.
And usually their preceptorships usually in that like September to October months. So
Cool.
you would do like an on-the-job placement where you would shadow a PSW and learn more about that profession.
Yeah. So you need your GED to get into it, or your high school diploma, or equivalency, Canada Adult Education credentials if you're coming from another country. But you do need that just basic diploma. You don't need any special courses as long as you have that basic GED or high school diploma to get in. We're not asking for this program. You don't need to have so many maths or so many sciences or a certain English. You need to have your basic GED to get into this program.
And to add on to that PSW, you do have that option to go into those pathways, which we'll talk about a little bit later in more detail, to then upgrade to the licensed practical nurse should you wish.
Yeah. So going a little, we explained it a little later, but going into what Crystal was trying to allude to is, if you don't have, like the practical nurse program, we need specific requirements from your high school education, as a biology. So if you take the GED and you come in as a PSW and you do well in your anatomy and physiology course, we count that as your biology to get into the licensed practical nurse program. So you don't have to go back to high school if you decide to continue after your PSW. You can continue, provided that your grades show that you can continue.
So for the licensed practical nurse, it's extremely rewarding career. I've been doing it for 10 years. So we just provide that quality care. We get it's a 2-year program, so we're getting more of that acute piece and getting more into working in that hospital setting, caring for those more critically ill patients, and taking them on within that clinical setting. All stages of life, like from neonates right straight up to 108-year-olds. That's the oldest patient that I've had in my career was 108, and I've had them as early as hours old. You can work in various areas. So one misconception that a lot of students have when they come into our program is they feel that they have to take additional training to work in some of those specialty areas. That's not the case with the LPN. You're able to work in any of those areas in the hospital as an LPN. It just would vary based on what you were able to do as an LPN, depending on where you work. And you can take additional trainings as well. You can run your own business, and you can just work in very, very many different areas. Same thing with the PSW, increasing aging population. We're in a dire need for nurses of any of the different levels, and just a very, very, very rewarding career.
Very in demand.
Very in demand.
You get a job as soon as you graduate.
Very in demand.
Yeah.
So the admission requirements do differ a little bit from that PSW because there's going to be more requirements and more expectations when it comes to that LPN. So having some knowledge in biology, chemistry, physics, having one of those sciences, whichever is more kind of your forte, which one you more excel in or thrive in, would be recommended. But you do have to have one of those sciences, and you do have to have a grade higher than 75% in one of those sciences to apply and be accepted into the program.
Yeah, and it's also good that when we talk about our mission requirements, it doesn't say anything about English level here, but at least that the good writing English is always essential because there is some charting there. So practice your writing skills is always a help once you come into the program for charting purposes and documentation and things like that.
And going back to like when it's offered and things as well, so that is that 2-year program. There are some campuses that do offer it as a January intake as well. The difference with the LPN is you do get the summers off, whereas with the PSW, you go through the summer. So you get your summers off when it comes to being in that LPN program, and you will do your preceptorship at the end as well. Same thing, like on the job, getting to shadow that LPN and really up your skills and your knowledge level based on things, and having somebody to rely on, ask questions to, and all of that.
Yeah. So typically after the first year in this program, students are able to take on summer jobs in nursing homes and things like that to keep those skills up and to earn some more than minimum wage income to be able to support them to go back to school in the fall. Now, with the registered nurse program, it's offered at UNB and other schools all over the Maritimes, but our closest one is St. Fredericton and St. John. The St. John campus is adjacent to the regional hospital, and the regional hospital has the trauma, heart center, medical facility training. And it also has now Dalhousie Medical School right on campus, and NBCC's PN program is all in that same vicinity. They're all tied there too. So, I mean, the opportunities for the BN students as well as the practical nurse students and the medical students when they go here is the ability to work in a team environment and to collaborate and learn from each other. But typically, if you take a Bachelor of Nursing degree, your first year is your introductory courses with physical, social sciences, and a few nursing classes that focus on personal care and the elderly. And then in second year, they focus more on their specialties. That's where you'll get into the mental health and the young families. They go over to obstetrics in year 2, and they learn more about the relationships between bodies and diseases, like your pathophysiology and how that connects to the anatomy. And then in 3 and 4, the courses are much more concentrated on acute care and nursing community nursing. So in the Bachelor of Nursing program, it's a great program. It scopes over 4 years, but they spend a lot more time in this program looking at the theories of why things happen and the theories of why we do things. And it's very, very theory based for those skills. Whereas in the practical nurse program, we are more hands-on in teaching the skills. We do look at theories, but it's not so theoretical based, looking at tons and tons of journals to understand the care that's going to be given. There's a lot more hands-on care given. So in the practical nurse program, in second year, they will learn how to insert and take out IVs and things. Whereas in the registered nurse program, that doesn't come to year 3 or 4, where they learn to take IVs out and put IVs in. So they both work. There's a laddering process. So we're going to get into that next, which is the best part of how our system works in New Brunswick. We've really worked hard to make it a system where people don't have to take one level and then have to repeat to take another. And like Tammy put in the chat, math is very helpful. Yes, understanding basic addition, multiplication, and long division is extremely helpful to the program.
Another thing too, when it comes to the length of the programs, it's typically that 4-year program in St. John, but Fredericton does offer an accelerated 3-year program. And the requirements do differentiate a little bit based on marks and those kind of things to be accepted into that accelerated program.
Yeah, and typically you have to have already started another undergrad degree to get into that accelerated program. Now we're going to look at the pathways and bridging, and this is really important because I don't want anyone really worrying about marks or going away from home. The great thing about the collaboration that NBCC and UNB have is you can, like we started to say, you can start off by applying for a PSW program, being really successful in it, loving what you're learning and saying, yes, I want to bridge to the PN program. And then you, with a couple courses, you can come right, you need just a couple courses to be able to come back into second year and do the full second year program. And then you could have your full apply to get your licensing and write the licensing exam to be a practical nurse, a licensed practical nurse. And now we have an agreement with UNB where you can apply to bridge to the Bachelor of Nursing program, and with a couple courses there as well. A couple, I think there's a writing course and there's another, I think a statistic course. With those 2 courses under belt, they can come back in then to 3rd year and take 3rd and 4th year of the Bachelor of Nursing to become a registered nurse with a bachelor's degree. I have a student that was in the class before Crystal, who came in and did her licensed practical nurse course and got her licensing. And after a year of working in the field, she went back and got her Bachelor of Nursing. And the other day I went for a physical for myself, and she was doing one of her practicums because she's now going to be a nurse practitioner. And it was kind of really cool to see a post student of mine from the practical nurse program has now gone all the way up to being a nurse practitioner, which is 2 years even after the 2 years of schooling, like a master's degree after the bachelor's program. So the opportunities and the pathways are endless when you come in to NBCC and take the PSW or the practical nurse program.
No, I agree 100%. Whereas, and sometimes you take your course and that's your passion and that's what you want to do. You never want to upgrade. Like myself, I have no intention to upgrade. I love my job as a PN and that's what I want to do. And others want to keep going, and that's totally up to you, but that those options are there. And you can, even just by staying with what you took in school, like myself as an LPN, I have taken additional training to work in various different areas as well. So there's that option of not having to upgrade to the RN, but I can upgrade my skill and what I'm able to do as an LPN.
Absolutely. Like foot care courses.
Yeah, I was running my own foot care business as well before I started teaching.
Okay, so we did that. So no matter which program you start with, the future is bright and the path has no ending. It can go as long as you want, or take you to whatever direction you want to go in. The passion and the love is there.
Awesome.
Any questions that have come into you, Nadine?
No, thank you so much. Tammy, did you want to add anything at all to the students that are listening? And I know that was a lot of information very quickly. So certainly students, if you are thinking of questions, we have 2 beautiful experts that sometimes people are very busy, and you have 2 beautiful NBCC experts here that could probably answer your questions fairly quickly. If you're thinking about maybe applying, not applying, there are questions I'm sure that are kind of in your head, and I certainly would have questions if I was making that decision. I do know that my family is full of nurses and they love their job. They're extremely passionate, just like these ladies are, and it's a job that will be super fulfilling, but again, also challenging. And especially in the times that we are today, I think most jobs are challenging in the world we live, which is beautiful on one end, but can also be a little bit scary. So if there's a question that you can think of, please put it in the chat, or you can turn your camera on and be brave and ask the question. But I'm going to turn it over to Tammy just to see if she has anything else she would like to say about the programs.
Thank you, Deneen. Actually, I think that Stephanie and Crystal did a really good job kind of introducing what our program looks like. I too have been a nurse for a very long time, longer than Stephanie actually. So there you go. Not by much, but a little bit. And of course, I love what I've done over the years, and I too have kind of had many journeys and different. So I think one of the things that the ladies talked about is that there are really so many different things that you can do in the profession in healthcare. Period. So from Crystal's kind of talked about some of her different opportunities and pediatrics and critical care and outside the it doesn't even have to be within the hospital, the special care homes, in the home, home care, those types of things. So there's so many opportunities. I think one of the things that I do want to just mention, just because we're talking about some pathways here, and one of the things that didn't get mentioned is that the two terms for PSW and practical nurse, the first two terms are exactly the same. So they actually, the PSW students and the PN students are combined for their first two terms and have the exact same curriculum. So it makes it very easy to make that transition over to the PN program if that's an interest. The only piece that we have to be worried about is the seat availability for that transition. But even if it doesn't happen, during that your PSW course, it can happen later, and it's a pretty smooth transition.
Yeah.
Something else I wanted to mention, just by being an alumni, I guess, is that it can be really scary applying as a grade 11 student, a grade 12 student. Like, I'm making a life choice for my entire life, for my family someday down the road, for all of those things. It can be very scary. But we are a province-wide team. The instructors are super supportive. I've worked at 2 different campuses and collab with instructors all over the province. We're basically a family. We work as a big team. We've got Tammy as our support system, and we're here for our students. We do whatever we can to help them be successful, to help them succeed. Anything we can do, we can have private meetings with you to help you succeed, anything that you need. I myself, as a student, I was an older student when I came, not older, but not a high school student. And it was scary. I had a little boy at home, and it can be done by the support of good instructors, a good team, and that whole approach. So don't let the fear of failure not let you apply, because that's not what we're here to do. We're not here to set anybody up for failure. And we're all here to support you and to be successful and all those things.
And you probably will have heard from universities that the teacher-class ratios are sometimes really big. They could be one instructor for like anatomy for 100 students or more. When you come to NBCC, the ratios are much smaller. I know at our campus here in St. Andrews, the fall term with the PSWs and the PN, the class size is like 32. So you do have that ratio to be able to ask the questions and make relationships with the students and the teachers, because and then that first year when that ratio goes down, so that some of those classes go down to ratios of 1 to 16 for your courses. So you do have that intimate relationship with the students compared to those first years, especially if you come from a small high school. Going to sometimes a big university where there's a lot of big classes can be overwhelming. We're coming to like an NBCC where your ratios are smaller, might be a good way to break into the system and then go on to university for your final 2 years. I know when I went off to university from high school, I picked the university that had the smallest student ratio because I was I was in Ontario. So, I had Queens and Ottawa U and Carleton, which the ratios were like one teacher for intro to psych was like 300 students, which overwhelmed me completely. So I went to St. FX because I knew my class sizes were going to be under 100. So, I mean, it's not the same, but you can have it in your own province, having the same kind of, if you're overwhelmed by not feeling like the teacher's going to get to know you because there's so many of you, you can have that smaller ratio at the college level.
Absolutely. And I would actually give my example as well. I went to school in the States and I had 650 students in my human anatomy and physiology course, and I felt
Yeah.
like a number.
Yeah.
And I certainly was a number in the profession's eyes and professionals' eyes. So it is it is a really kind of a special way to teach. And I think it's a if you're a student that really needs to feel a part of something, this program certainly would be for you. I have one question.
Yeah.
If a student was curious about the St. Andrews campus, and if maybe they're in Fredericton or they're in St. John or in the Graham and Ann, because I've had some students reach out in other spots, even in the country, how would they go about connecting with somebody in St. Andrews and maybe coming to see the beautiful campus, and what does that look like?
So we do have open houses, as well as we have a college preview day coming up on May 23rd.
Yeah.
Tammy. So we highly recommend the schools can reach out as well. Like, we have bus loads of kids who come down and students to view and see our school. They can ask the questions, they can see the campuses, they're able to see the equipment, how the labs are set up, all those different things. Highly recommend it. You can find out exactly like how the terms are going to roll out, what's going to be expected of you, all those different things. So coming and viewing and asking those questions. I don't know, Tammy might be able to answer this. Do we still have the option for students to come and like shadow for a day?
Okay.
So most of those opportunities happen through recruitment.
Okay.
Right. So that would
Yeah.
just be a reach out to recruitment, and then, setting something up at the campus that you choose. So we are talking St. Andrews right now for sure, but just, when you're thinking about opportunities, we have campuses in Moncton, Miramichi, Fredericton, St. John, Woodstock, and St. Andrews, and approximately about 700 students across the province in the PSW and PN program alone. So
I know that UNB, I believe, does do college preview things as well. Just watching their websites, reaching out to their college recruitment leads and things to see when those open houses are, all those things. And a lot of times you can apply right at those open houses to get your seat when it comes to that university level. You can be accepted basically on the spot sometimes. So it's a good thing to do. And you can start looking and applying in those grade 11 years, which I know is scary because you're young and you're relying on your mom and dad right now, but it's a big, beautiful world, and with the proper support, you can do big things.
And it's not when you apply, it's not written like a tattoo where it can't come off. You can change your mind in second year. In grade 12, say, no, I don't want to be a PSW. I want to go right to PN, and flip that, or flip it the other way, or flip it to lab tech out of St. John, or anything else in the science fields. So just because you apply doesn't mean it's permanent ink on your body. You can change that. So, but I do think that coming for a day, talking to recruit, and coming and spending the day never hurts. I've had students who have shadowed me for a term and used it as their co-op. It's happened only once, but it has happened that we've had students here for co-op. So, I mean, there's lots of opportunities to come and get your toes wet and see what you want to do.
And talking to different nurses and PSWs that work in different areas, being able to come, and there's pretty much all of us that, or a lot of us that work here, all once went to this campus, and being able to see the different experiences of each person, where they've worked, all those things, and learn about the profession is a big one too.
Awesome. Well, a wealth of knowledge. And I think I guess the message for today is that we just opened a door, and that door is open now. And if you have additional questions, or you leave this session and you start talking to your friends, or you start talking to your support system that's home, and some more questions come up, please feel free. And if you forget the names that are have presented today, please feel free to reach out to the Center of Excellence for Health, and I can certainly connect you to the folks that can help answer those questions. As you heard earlier, there are open houses. They are planned for around the province. They typically are at the end of May, so you can certainly find that on the NBCC website. And I will say that I've been to many of the campuses around the province, and they are beautiful. And the staff that there is even more beautiful. So if you're looking for something in health and sciences, you certainly have found the right spot. I'm going to say thank you so much from the Center of Excellence for Health. We're very, very grateful and thankful that we've had our experts here today. And if you have additional questions, don't be afraid to reach out. Teachers, I will be sending you a survey just to tell us about your experience today. And thank you so much.
You're welcome.
Thank you. Bye.
Bye.
Thank you, Deneen.